So good morning, everyone. I see people are now joining. We're just going to wait a few minutes for the numbers to get up. But I think while we're waiting, for those of you who are here bang on 10 o'clock, we've got a little poll that we thought we'd just run whilst we're waiting to everyone join. If we can just see there, just two quick questions, just to see how this is going down with in the industry. So, do you support the policy? Are you not sure? And do you expect, what sort of numbers do you think of your workforce will be unvaccinated on the 11th of November? Okay, well, we've hit half a century of people, so perhaps let's have a quick look at the how the poll's gone. Those of you who had a chance to complete it, you see the results, then yes, so majority of people supporting the policy, still several people unsure. And we're expecting majority seems to be 0 to 5, but if we under 10% will be the majority, 83% there, which sort of chimes really with the government consultation. For those of you who will have seen that, whilst total respondees were opposed at 57%, 76% of care home providers were supportive or rather supportive of it. And the Department of Health's view was clearly that it's, whilst not a silver bullet, vaccination was proving effective at preventing serious illness and reducing transmission rates. So thank you very much for joining us today. Welcome to everybody who's got up on a Monday morning to come and join the seminar. I'm pleased to be joined by my colleague Stuart Craig, who will be leading the sort of employment law section of this, and delighted that Sandesh Singh from Crown Office Chambers has been able to join us. Sandesh is an expert regulatory lawyer, barrister at Crown Office Chambers, and I'm a regulatory lawyer at partner at Mills Reeve, so specialising in sort of CQC enforcement in particular. So I'm pleased to be able to talk to you this morning and share our thoughts on the new policy. So let me just pull up the slides that we've prepared. Give me a second. So hopefully you can all now see the slides. And we'll start. So what we're going to cover this morning is, there's a little bit of a delay, I think. So the agenda this morning is we're going to look at the legal requirement, what actually is being required. We'll look at enforcement and employment issues. We're going to take those the other way around, actually. So we'll deal with employment enforcement and then employment issues, and then deal with a few questions at the end. So what is the actual new legal requirement? Well, effectively, the government has amended the legislation, the regulated activities regulations, to bring in an additional fundamental standard under safe care and treatment. And that is that for the purposes of complying with your duties of assessing risk, preventing and controlling the spread of infections, it's now necessary to ensure that people are vaccinated or otherwise exempt. But you'll see that this only applies in respect of the regulated activity of the provision of residential accommodation together with nursing or personal care. So it's only those people, those providers whose registration is for the provision of accommodation and personal or nursing care that are currently caught by the regulation. So looking a bit more detail about what is required, well, the duty is on the registered person. And you'll see that the registered person is defined as meaning the service provider or registered manager. So both the service provider and registered manager are the people who have to ensure or secure that a person does not enter the premises unless they meet one of the exemptions. It only applies in respect of a care home, and the care home is effectively somewhere where you're looking after people who are disabled or infirm or dependent, and is not a hospital. So I think for the majority of organisations that are registered for accommodation and care, you will fall within the definition of a care home. And then in terms of the application of this duty, it is to the premises, which normally includes, you'll see at the bottom there, all of the buildings and the surrounding grounds. Well, for the purposes of this particular requirement, they've taken away surrounding grounds. So it only applies to the actual building or a vehicle if you're using those as part of your provision of care. But important thing is it's anyone entering the building must not do so unless they meet one of the exceptions. So the exceptions for the people entering, I'll just go through those in order. So obviously service users residing in the premises. So anybody who's already living in the premises, they would fall in within the exception under A. But it's interesting to note that it doesn't apply to prospective residents. So anyone who's coming for a visit to look round as a potential resident, they're not covered by that exception. So they'd have to fall within another exemption, which is most likely B, that they're able to provide evidence. So you would obviously need to check this. Evidence that they have been vaccinated with a complete course of an authorized medication, authorized vaccinations. So this is the sort of exemption that will apply to most people, and the one that will apply to most of your staff, that they are able to demonstrate they've been completely vaccinated. Obviously, the government accept that there will be some people that for clinical reasons can't have the vaccination. So under B2, there is also an exemption for those people who can demonstrate that they should not be vaccinated for clinical reasons. At the moment, there is we're waiting for the full details of the procedure that's going to be adopted for effectively applying that exemption, how people go about demonstrating that they are clinically, for whatever reason, unable to be vaccinated. At the moment, so with effect of the first sort of 3 months of this policy, there's going to be a sort of temporary self-certification scheme that will allow people to, individual workers or others, to demonstrate that they, or to self-certify that they should not be vaccinated. But we'll see a sort of more formal system coming in due course. The third exemption is that it's reasonably necessary to provide emergency assistance. And it's clear from the guidance that is emergency, that is something completely unforeseen, unexpected. It's an emergency situation that someone needs to come in. But the same with reasonably necessary to provide urgent maintenance assistance. And the guidance that sort of accompanies the regulations does look at that. And certainly it says that it's got to be something, there's a sort of risk to life or continuity of care. So things like the breakdown of the gas or water supply, a dangerous electrical fault, serious damage caused by fire, flood, storm and explosion, burst water service, serious roof leak, gas leak. That sort of problem where something that it needs to be fixed now, it is definitely an emergency. So any sort of planned preventative maintenance, etc., would fall outside of that. You'll see there in E, those attending as a member of the emergency services, so police, fire, ambulance, would not be required either. And then sort of, to some extent controversially, B is a friend or relative of a service user, and that service user is or has been providing the premises. So friends and family, don't need to be vaccinated. G, B is visiting a service user who is dying. And H is reasonably necessary for B to provide comfort or support in respect of bereavement. So particularly the guidance envisages there that you'd have people coming to provide religious, undertake a sort of religious service or spiritual guidance, or visiting following bereavement. And then obviously the final one is under 18, so no one under 18 is required to be vaccinated. So interesting there, where there's a sudden drive to recruit 16, 17-year-olds. But that's the list of exceptions. There's a couple of other issues that sort of arise. Well, which vaccine? So an authorized vaccine is the term used within the guidelines. So that means authorized by the MHRA here. So at the moment, that's 4 vaccines: the Oxford, AstraZeneca, Moderna, Janssen, and Pfizer are the ones that are authorized in the UK. We understand that there is the department are working on a solution to allow find some way in which you can take account of people who have been vaccinated overseas with vaccines that aren't authorized here. How long that will be, what it will look like, we don't know. But that's generally the outline of the requirement. So, in summary, it is a requirement for everybody is excluded unless. So that's the way of looking at it. You can only enter these premises if you fit one of the exceptions. But as you know, there's been a few headlines over this. That it isn't without its controversy. So I just wanted to flag that the new regulations are subject to a judicial review challenge at the moment. And I understand from press releases that a claim form has been issued. So the proceedings have actually been commenced, challenging the lawfulness of the regulations, saying that they're incompatible with previous legislation that sort of said you can't do this. The Health Secretary hasn't considered all the alternatives to compulsory vaccination. There's an interference with people's bodily integrity, will disproportionately affect certain members of the community, and it's irrational because it will lead to shortages in frontline and non-frontline care workers. So we'll have to wait and see how quickly that progresses, whether it's given permission and whether it'll proceed to a full hearing. But very, very interesting to see how that JR progresses. So that's all I wanted to say about the sort of duty itself. And I'm going to hand over, there's one more thing I was going to say in terms of further developments, that the government have now started a consultation on extending this more widely within the health and social care sector, and looking at effectively applying the same requirement to providers of all regulated activity. So that would be all social and healthcare workers, whatever they're doing, except, I guess, remote consultations. It may not be necessary. So you can have your say on that until the 22nd of October. But it's a clear signal from the government that this is only the starting point. They do intend to see this across the entire industry. So now I'm going to hand over to Sandesh Singh. As I say, he's from Crown Office Chambers, one of the leading regulatory sets in the country. And over to you, Sandesh.
Thanks very much, Duncan. Good morning, everyone. Well, so I'm going to talk about the CQC's involvement and enforcement issues. And the starting point is, as is set out in the DHSC's operational guidance, which I'm sure many of you will be familiar with. The requirements introduced by the 2021 regulations form part of the fundamental standards, which are monitored and enforced by the CQC. And the CQC have published a short statement outlining their proposed approach. And on the next slide, I've included what they say they will do if they receive information indicating a concern in relation to vaccination arrangements at a care home. So essentially, they will follow up that information and either seek assurances from the home or carry out an inspection to confirm that appropriate systems and processes are in place. And if we can look at the next slide, in relation to what records they would expect to be available, their statement says that registered persons won't be required to show a record of the evidence seen, but the CQC will want to see records to show that systems and processes are in place to meet the requirement. But registered persons may choose to make more detailed records of evidence seen in relation to their own employed staff, but that isn't a mandatory requirement. Now that approach is in line with the DHSC guidance on records which need to be retained, which I've set out on the next slide. I don't need to read that out, but it's page 23 of the guidance. But if we can move on one more slide, there's an example given on the same page where to the effect that for visiting professionals, an additional column in the visitor's logbook to indicate that vaccine status has been confirmed could be added, and that would be sufficient for external visitors. Now, I've been through those points just briefly because, as many of you will be aware, the DHSC held a webinar at which Alison Murray, the head of inspection at the CQC, gave some further explanation of the CQC's likely approach to enforcement in November this year. And I've summarised some of the key points from that in the next few slides. So she started off by emphasising that because registered providers and managers know their services better than anyone else, the CQC, she said, isn't going to be prescriptive about the systems and processes required to meet the new regulations. But she gave some advice to carry out a risk assessment process, talk to your team and any regular visiting professionals, decide how you're going to make it all work in practice, and make a record of discussions and review any actions you're going to take regularly. And that's helpful to some extent, but I'll come back later to what that may mean in practice in relation to staff shortages, which is a particular issue that I know many are concerned about. And so moving on, she also gave some commentary about what the CQC would be looking for in terms of records, which broadly chimes with the guidance that I've already referred to. And she was quite keen to emphasise, as I've said there on that slide, the CQC won't be prescriptive about the format of records kept. And she referred back to the logbook example, which I don't need to go back into. But she went on to say on the next slide something relatively encouraging in relation to enforcement. And so I went back to try and make sure that I've got the words right, but the essence was this: if there was a breach of the regulations, the CQC could take enforcement action in the form of fixed penalty notices or prosecutions, so criminal enforcement action. But she said that we think this would happen in very, very, very rare cases and would more likely form part of wider concerns about the service. And she said that the CQC is much more likely to use its civil enforcement powers, so requirement notices, warning notices, and conditions. And if we can go on one more slide, she said this specifically in relation to that issue of concern about staffing, that if there's potentially a short-term tension between deploying vaccinated staff and the requirement to have sufficient staff to provide safe care and treatment, and there's what she called a nice risk assessment and a risk mitigation plan, then the CQC is not likely to go down a heavy enforcement line, and it's much more likely to fall somewhere around the lower end of our actions. What she means by that wasn't entirely clear, lower end of our actions. That, given what she said earlier, it seems like it means civil enforcement rather than criminal. But it seems to be the position that they would consider some enforcement if on the face of it, there's a breach of the requirement. And so if we can move on one slide, that tension between deploying vaccinated staff and the requirement to have sufficient staff to provide safe care is one of the major concerns I know moving forward. And the way that Alison Murray addressed it was in the context of the requirement being, to use her words, compliance being pretty binary. Either you're meeting it or you aren't. And so I wanted to look at whether if a provider was forced to rely on an unvaccinated member of staff in particular circumstances, for example, from an agency, because there was a shortage on a particular day, there might be a way to argue that the circumstances fell within one of the exceptions in the new Regulation 12.3. Or if that wasn't possible, and it would on the face of it be a breach of the requirement, reliance might be placed on the due diligence defence, which is provided by Regulation 22.4 of the 2008 regulations. And so if we can move on to the next slide, looking at the new Regulation 12.3, it seemed to me the only one that could possibly apply is subsection C, which says that person A must secure that person B doesn't enter the premises unless, subsection C, it's reasonably necessary for B to provide emergency assistance in the premises used by A. And so the obvious question being, well, if we're short-staffed on a particular day, could it be classed as an emergency, and therefore an unvaccinated member of care staff could be brought in under 12.3C? Well, emergency assistance, that phrase has been used in COVID-19 legislation for some time. And some of you may remember it was used in the original lockdown regulations back in April 2020 as one of the reasons why a person might have a reasonable excuse for leaving their house to provide emergency assistance for someone else. But it was never defined as far as I can tell. But the DHSC operational guidance does provide some information, which is on the next slide. And it says this: an emergency situation could include, but isn't limited to, members of the public assisting in the event of a flood or fire, and social workers responding to immediate safeguarding concerns. And so while the list isn't exhaustive, it implies an unforeseeable event, like a flood or fire or similar. And I think it is unfortunately unlikely that staff shortages on a particular day would be considered to fall into that category. And so realistically, if we move on to the next slide, the only recourse is likely to be the due diligence defence to a breach of Regulation 12, and which provides, it's Regulation 22.4, it's a defence for a registered person to prove that they took all reasonable steps and exercised all due diligence to prevent the breach of any of those regulations that has occurred. And so, as far as I'm aware, if we go on to the next slide, there's no specific case law on that regulation, but it mirrors the wording in consumer protection law. And so those kind of cases provide some insight. What's clear, though, is that what's required in any particular case will depend on the facts, the extent of the risk, and also the size and resources of the defendant's operation. Now, a detailed discussion of the nature of the test is probably outside the scope of this presentation, but if we go on to the next slide, it's probably worth just reading from one old case where the court said the appellants had to, and this was a safety of goods case, they had to establish some kind of system, whether by way of random sampling of the goods or whatever, to ascertain whether the goods conform to the description. That doesn't mean that the system had to be foolproof. No system could be that, nor did the appellants have to examine every article, but they did have to do something. And so just hoping for the best and reacting if staff shortages arise clearly isn't going to be enough. There needs to be advanced thought given to what steps it would be reasonable to take in order to comply with the new requirement. And then all due diligence needs to be exercised so that the necessary steps identified are actually taken both generally and specifically if there is a lack of staff on a particular day. And so on the next few slides, I've set out what, from my point of view, I think the headlines are here. And as I've said there, it seems likely it's going to be extremely difficult to rely on the defence if staff shortages arise due to a failure to prepare adequately within the grace period provided by the regulations. And preparation would ideally be in accordance with a written procedure But in any event, in line with the operational guidance, and there's some pointers, for example, in Annex A, and also resources provided by other organisations, for example, Skills for Care. And preparation would involve, I would suggest, and as I've set out on the next slide, early engagement with the workforce in order to secure full compliance with the requirement if possible, and appreciating that there will be some who are not exempt and don't wish to be vaccinated, exploring and seeking to address the concerns raised and keeping records to show that those steps have been carried out. And if we go on to the next slide, I mean, what can be done to address concerns? Skills for Care provided some examples of what's been done on their website by various providers. I won't read them all out, but it's things like facilitating access to clinicians to discuss concerns, paying staff travel costs to attend vaccination centres. Those are some of the steps which could be taken to help show that the defence is made out in terms of planning for the 11th of November. And then consideration would probably need to be given to the matters on the next slide. And so addressing the position of staff members who aren't exempt and aren't willing to be vaccinated, and I think Stuart's going to cover the potential approaches to that in a moment, but then identifying any actual or potential shortfall and taking steps to secure those who are or are willing to be vaccinated. And then considering the service overall, because consideration would need to be given to how many beds it's reasonable to keep open if you know that there will be insufficient vaccinated staff. And so in relation to the second point, trying to source others, if we can go on to the next slide, it's going to be important to show reasonable steps have been taken to source vaccinated staff or those who are willing to be vaccinated before relying on unvaccinated staff in a particular situation. And the issues, in fact, covered in the DHSC operational guidance, and I've set out what it says there. They mention flagging with the local authority who may be able to provide assistance. It's not clear necessarily what assistance the LA is going to be able to give in any particular case, but it's a step that providers should take as it's specifically outlined there. But just moving on from planning, the crucial issue for due diligence is going to be having a policy setting out how the service will react if there's an issue with staff shortages, accepting, as the DHSC and the CQC seem to, that such situations will probably arise at some stage, and then carrying out a risk assessment when faced with a situation where there's a shortfall in the number of staff required to provide safe care. And effectively, what's being weighed up, as I've identified in the last bullet point, is insufficient staff versus using, for example, an unvaccinated agency staff member. There are competing breaches there, potential breaches of Regulation 12. But in practical terms, if we go on to the next slide, what would need to be assessed is the risk of understaffing and the risk of transmission of COVID-19 to residents and or staff members as a result of deploying an unvaccinated staff member. And there would need to be an assessment of what measures could be used to reduce both risks as low as reasonably practicable. And all of that process would need to be documented. And I've set out some considerations which might be taken into account on the next slide. So firstly, focus attention on the areas of greatest risk. And so the risk assessment might take into account the care needs of residents. So what would the impact of understaffing be on the ability to provide safe care, and what might be the consequences? But also the most clinically vulnerable residents, even if vaccinated, unvaccinated residents, and exempt staff members who will be at highest risk of infection. The second issue is it possible to move staff into different positions or roles in the short term so that, for example, the unvaccinated staff member works with less vulnerable residents? And then also consider the third bullet point, is it possible to mitigate the risk of transmission in relation to the unvaccinated staff member by other measures? So the use of PPE, requiring proof of a negative test before deployment, things like that. And so much of this will be familiar. We go on to the next slide because of the requirement to risk assess in any event for exempt staff members. The DHSC operational guidance says that a risk assessment should be undertaken for staff members who are exempt from vaccination to reduce the risk of transmission. And so there may be some crossover with that process in any event. And so just to finish up with the final slide, please, Duncan. So the aim of all of that is to put in place a robust system so that if a situation arises where, on the face of it, there's a breach of the requirement for vaccination, there can be a discussion with the CQC to the effect that all reasonable steps were taken, all due diligence was exercised, there was no significant exposure to risk, and so as a result, no enforcement action should be taken at all, whether civil or criminal. And that potential outcome wasn't really covered by Alison Murray on the webinar. The impression given is that some enforcement would be likely, but it would be towards the lower end. But as I've set out there from the CQC's general enforcement policy, which she said does apply, not taking any enforcement action in certain circumstances is an outcome envisaged by the CQC. And the aim would be to try and persuade them to go down that line if a provider is forced to rely on unvaccinated staff due to shortages, which otherwise couldn't have been avoided. And otherwise, all reasonable steps and all due diligence has been exercised. All right, well, thank you very much. That's the end of my presentation, and I can hand over to Stuart.
Thanks, Sandesh. Morning, everyone. So I'm going to a bit of a change of tack now. I'm going to look at the key employment issues arising from the policy. I'm going to do that by looking at four key topics. So looking at discrimination, data protection, termination of employment, and recruitment. Before I get into those topics, just some general comments about how employers are and kind of should be approaching these issues. So these comments are based on the operational guidance, and they're also based on the ACAS guidance that was published on the 10th of September to help employees and employers at care homes in England to understand the vaccination rules. And the first obvious comment, just reiterating what Sandesh has said there, is planning and preparation is key and should have already begun and should already be being implemented. Employers need to know what the position is in respect of their employees as soon as possible. So the operational guidance talks about engaging with the workforce to identify the following categories of worker or of employee. So employees who can comply with the requirement for vaccination or exemption and can provide evidence. Secondly, employees who can comply with the requirement for vaccination or exemption, but who can't provide evidence. Employees who aren't yet fully vaccinated, but will be so by the 11th of November. Employees who aren't yet fully vaccinated and are unlikely to be fully vaccinated or exempt before the 11th of November. Then employees who don't want to be vaccinated and are not exempt. And then finally, employees who will be under the age of 18 on the 11th of November, but will have to comply with the requirement in due course. So identify which category of staff, which employees fall into. And then in terms of other steps that employers should be taking, the ACAS guidance advises that it's a good idea for employers to discuss with their staff the law and when it's going to apply, who will need to be vaccinated in order to enter a care home, who's exempt, how the employer proposes checking that someone is vaccinated, how an employee should prove that they're vaccinated or exempt, data protection issues, how staff can book a vaccination if they aren't yet vaccinated, what the employer's policy is for time off relating to being vaccinated, including sick leave where a staff member suffers side effects, and then the options for staff who aren't able to enter a care home from the 11th of November, and then how staff can ask questions or raise an issue if they've got concerns. So that's kind of some future general comments. I just want to focus in now on those key topics that I talked about at the beginning, as they're the kind of topics that are no doubt going to arise in conversations that employers have with their employees around compulsory vaccination. So first of all, discrimination on the next slide. Generally speaking, complying with the particular specific legal requirement that's required by the new legislation shouldn't give rise to a successful claim against an employer for discrimination because the employer is obviously taking action pursuant to a legal requirement, and compliance by the care home with the regulations is very likely to be seen as a legitimate aim. And that position is reflected in the quote there that's on the slide. However, perhaps inevitably, the position isn't as simple and straightforward as that. In particular, employers need to take particular care to avoid what I've called related actions, which could give rise to discrimination claims. So, for instance, in relation to redeployment, the operational guidance gives the example of using a criteria for deciding which unvaccinated employees should be redeployed to other work, that it might indirectly discriminate against people in relation to a religion if the criterion for redeployment prioritise people who could work on Sundays, because that would disadvantage Christian workers. And then again, in the context of disability and reasonable adjustments, the duty to make reasonable adjustments still applies, and that might be relevant in relation to the circumstances that I've set out on the slide there. So time off to attend vaccination appointments and potentially adjustments to the consultation and disciplinary processes to enable disabled workers to participate fully. And then just going on to data protection. In the time available, I'm not going to go into a massive amount of detail in relation to this. Suffice to say, employers have got to keep records about vaccination or medical exemption status to comply with the new law, and any information that they process has to be processed in accordance with data protection law. And in terms of kind of what that means for employers, well, in the first instance, I think it means that all existing data protection and privacy documentation and assessments need to be reviewed and updated to ensure compliance with the regulations. But really the key points are set out on the slide there. Turning to perhaps what's the most burning issue, which is termination of employment. And on the next slide. So as employers are acutely aware, the logical consequence, potentially, of the new legal requirement is that staff who aren't vaccinated and who aren't medically exempt by the 11th of November may need to be dismissed. And following on from that, employees who've been continuously employed by their employer for 2 years have the right not to be unfairly dismissed. So how do you avoid a claim for unfair dismissal? Well, broadly speaking, in order to fairly dismiss such an employee, an employer is going to have to show that there's a potentially fair reason for dismissal. That reason is sufficient to justify the dismissal, and that a fair procedure has been followed. So what about this first issue of a fair reason? What's the fair reason for dismissal in these circumstances? So the reality is employers should be able to establish a fair reason for dismissal as a result of the new legislation, with employers most probably relying on one or potentially even both of the fair reasons I've put out on the slide there. So statutory restriction and some other substantial reason. And some commentators have also talked potentially about relying on capability as being a fair reason. I think the point to take away is employers ought to be able to establish a fair reason. So what's going to be most important is the procedure that's followed. And that comes back to the point that I made in this section about planning and preparation, the point that Sandesh made in his section about planning and preparation. So that's essential so that employers have enough time to follow a fair procedure. In terms of what does a fair procedure look like? Well, the operational guidance summarises pretty well, actually, the steps that should be taken to ensure a fair procedure. The key points to take away, I think, are having an individual consultation meeting with the employee in question to discuss the position. So what does the employee think will happen next in the event that they aren't vaccinated or medically exempt? Going again back to Sandesh's talk, are there any doubts that can be assuaged? What steps could you take to persuade people to comply? But in that meeting, there's a job to be done in terms of making the employer's position clear if the requirement isn't met. And then if the employee won't get vaccinated and they won't be medically exempt, and there's no alternative to dismissal, just pausing now about alternatives to dismissal. I mean, alternatives to dismissal such as redeployment should be considered. I mean, clearly, whether that's practical and possible and logistical is going to depend very much on the employer in question. But certainly for some small operators, it probably won't be practical. So you then need to have a further separate meeting with the employee if there's no alternative to dismissal, at which they're accompanied to issue any notice of termination. And then any dismissal notice, you'd also ideally offer the employee an appeal against dismissal. So what does that mean in terms of notice? Well, by my calculations, the 11th of November is just under 8 weeks away. And that means that any employee with more than 8 years service currently won't be able to work all of their notice period, their statutory minimum notice period, even if they were dismissed today. So what are the options for them? Well, that may mean that they have to be paid in lieu of notice, or paid in lieu of some of their notice period, or that they have to continue to be employed, but in circumstances where they don't enter the care home. And all of that is obviously a cost for employers without any benefit being derived in terms of the work or any work being done. Now, a final point that I just wanted to flag on the slide is the issue of collective redundancy consultation. Just to point here, the reason for dismissal individually won't be redundancy, because employers will still have a requirement for work to be done. But that doesn't necessarily mean that the collective redundancy provisions won't be engaged. So if a care home has 20 or more unvaccinated employees in a single care home, the question arises as to whether the collective redundancy consultation requirements are engaged. And if so, whether you need to collectively consult if you're proposing to dismiss 20 or more employees. There's views both ways. It's not something that's addressed by the operational guidance. But my strong advice is, if you find yourself in those circumstances, that you take advice in relation to that situation. And then turning away from termination to recruitment, so away from the immediate problem potentially into kind of employing future staff. The new laws, whilst it's obviously got massive implications for existing staff, it's obviously got, albeit it's got implications for new staff as well. So I've posed the question there: should vaccination be a contractual requirement for new starters? Well, in short, the answer is almost certainly yes, but obviously you need to draft a contractual requirement carefully to make sure it properly reflected the legislation and the medical exemptions. I've also put some kind of practical points on the slide there about recruitment of new staff. So first of all, notifying applicants of the requirement for vaccination or exemption at the start of any recruitment process. And then not losing sight of the fact that any interviewees coming on, attending onto the premises will have to provide proof of vaccination or exemption before entering the care homes if the recruitment process is being done within the care home. And then finally, just in terms of pre-employment health questions, some of you may know the Equality Act contains provisions kind of prohibiting employers asking questions to applicants about their health, unless the question that's being asked is necessary to establish if the employee can undertake a function that's intrinsic to the work concerned. So my view there is that you could ask for proof of vaccination or exemption, but you shouldn't go further than that in terms of health recruitment, kind of health questions pre-employment. So they were a kind of whistle-stop tour through the key employment law issues.
Great, thank you, Stuart. So hopefully that's been really useful. We do have time for a couple of questions. I should have said at the outset that we'll send a copy of the slides to everyone who registered. This is being recorded, so you'll be able to see that link as well. And we're also asking for you to complete a survey. If you could do that before you leave, just really helpful to know how these have gone down and any topics for the future. But in terms of questions, Stuart, we've had one in that's probably best for you, asking for sort of more detail about the temporary medical exceptions process, and particularly the time period with which it runs.
Yeah, thanks for that, Duncan. So Duncan alluded in his section to the kind of temporary medical exemption. There was a letter issued by Claire Armstrong, dated the 15th of September. So look out for that if you haven't seen it. What that says is that on a temporary basis, people who are working or volunteering in care homes who have a medical reason why they're unable to have a COVID-19 vaccination will be able to self-certify that they meet the medical exemption criteria using a kind of template form that's attached to that letter. I mean, it's interesting actually that letter, specifically refers to time-limited exemptions being available for those with short-term medical conditions, and in particular for pregnant women should they choose to take it. In terms of kind of the question that's been posed, do you understand that the temporary self-exemption scheme will apply from the 11th of November for 3 months? Well, actually, the position is that that kind of 12-week period starts from the new system going live. So the permanent system in relation to medical exemptions. So it's not 12 weeks from the 11th of November. It's 12 weeks from when the new kind of formal permanent, if you like, medical exemption system is established. And then just in terms of the statements that have been made by DHSC in relation to this kind of temporary exemption, a kind of key one is that care providers should accept self-certification and are not required to make any kind of clinical assessment. The form requests that the person clarifies that they meet the medical exemption criteria. It does not require the person to disclose a particular condition that they might have. That statement goes on to say the intention is to establish the formal permanent system shortly, but self-certification will be considered sufficient evidence for exemption until 12 weeks from the date that the permanent arrangements are put in place. And then it goes on to say that that 12-week period is to enable people to apply via the formal system once it's established, get a result from the formal permanent system, and choose whether or not they want to get vaccinated or get both vaccines. So it is something of a kind of stay of execution.
Great, thank you, Stuart. So now, another question that we've got is probably one for you, Sandesh. If I can't get a shift covered, do I need to tell anybody?
Yeah, so I mean, short answer is yes. CQC would need to be informed. There's a requirement under Regulation 18 of the Care Quality Commission Registration Regulations 09 that a provider's got to inform the CQC without delay of various incidents. And that includes any incident which prevents or appears to the service provider to be likely to threaten to prevent the ability to continue to carry on the regulated activities safely or in accordance with the registration requirements. And then it specifically lists there being an insufficient number of suitably qualified, skilled and experienced persons being employed for the purposes of carrying out the regulatory activity. And so there would be a requirement to notify. It's referred to in the DHSC operational guidance, in fact, and that requirement to notify arises whether or not there's actually been an incident with a service user. The incident is the lack of staff. And so it would when you say we can't get a shift covered, if ultimately you end up with less than the required staff, or you end up having to force to use an unvaccinated agency staff member, whatever your risk assessment says, then there would be a requirement to notify. But I think the important point to emphasise is that kind of situation should only arise despite proper preparation, despite efforts to source vaccinated staff, despite all other potential options other than using an unvaccinated staff member being considered, and despite risk mitigation measures in place if that's unavoidable. And so if you do need to notify the CQC, you should also be in a situation to justify that all reasonable steps have been taken and all due diligence exercised when they either seek assurances or inspect, which they've said in their statement that they will do.
Great, thank you, Sandesh. Then another question about sort of occasional workers and non-care staff. Do they need to be vaccinated? Well, the answer is anyone who's entering the buildings of the care home, then they do need to be vaccinated, whether they're attending on a single occasion, multiple occasions. So, you know, the chef working in the kitchen will need to be fully vaccinated. So the only sort of limit they put on that is people working outside the care home, so gardeners in particular. If they're only coming into the garden to carry out, you know, mow the lawn, weed the flower beds, etc., then they don't need to be vaccinated. But you might also like to think about whether there's any potential for them to interact with care home residents. So while it's not a specific requirement of this, in terms of your general infection prevention control measures, you might need just to think about residents who are in the garden when unvaccinated staff are there, whether there's any particular risk of interaction that you want to manage. Of course, they're outside, and we know the risk is much lower. We've had another question about whether the booster vaccination is considered part of the course of vaccinations. I'm pretty sure, looking at that, that it's not, that it's just the two courses of dose. So it's nodding there, that's covered. So it's yeah, just being fully vaccinated is whatever the recommended course, because of course there is a one dose vaccination as well.
My understanding there, Duncan, is that if that is going to be made a requirement, the regulations are going to have to be amended to deal with that. There's a few questions coming about notice. Do you just want me to pick those up? So some questions are about the timing of notice. I was probably just picking up on my comment there about employees being required to be given notice, and some of that may take employees past the 11th of November. Question here: at what point are we able to dismiss? Do we proceed on conclusion of the consultation, i.e. now, to prevent excessive pile-on costs, or do we need to wait until the 11th of November? I mean, you can. The key thing is following a fair procedure. Once you've followed the fair procedure, you can dismiss, and you could do that now, but with the dismissal to take effect on the 11th of November. So you don't need to wait to the 11th of November and then incur the pile-on costs post 11th of November. Another question: if the dismissal meeting is held this week and an employee has 4 weeks' notice, should we wait until 4 weeks before the 11th of November to serve formal notice if we want them to work up to the 10th of November? The question there is that you know you're only obliged to give them their minimum notice, but there's nothing to stop you giving them a longer notice period. So you could give them notice that will take effect on the 10th of November, even though you're not. You know, you're only obliged to give them 4 weeks' notice. A question there is whether you think between, you know, in the intervening period, you could persuade or cajole or get the person to change their position such that you wouldn't actually have to give them notice in any event. I mean, I have heard of some employers kind of giving conditional notice, so that the notice of dismissal that's issued, you know, says that in the event that you are unvaccinated and are not medically exempt by the 10th of November, dismissal will take effect. So that's potentially something else to consider as well in relation to notice.
Great, thank you, Stuart. Well, we're coming up to 11 o'clock, so I'm going to call time on the proceedings there, and just want to say again to everybody, thank you so much for joining us today. We hope that's been a sort of useful canter through the new regulations and helps you grapple with some of the issues. As I said, we'll send out to you a copy of the slides for your information, and there is a little survey for you to complete before you go if you've got time to do that. But I'd really like to thank Sandesh and Stuart for joining me this morning, and thank you very much. Have a good rest of the day.